So, Bulbasaur, the Pokemon, and I were having a discussion, as one typically does with Pokemon, regarding the determinants of health. Bulbasaur thinks that the personal choices that an individual makes and the health services they can access are the only determinants of health. And I did let Bulbasaur know that personal choices, behavioral choices, either whether to participate in a behavior that promotes or reduces your likelihood of encountering a disease, is definitely a determinant of health. And that also the services we have access to are a huge determinant of health. If you don't have access to a job that provides health benefits, because in this country, we associate our access to health benefits with employment. So if you're not able to work full time, if you're disabled, etc., you may not have access to health benefits. And that greatly reduces your ability to access healthcare services, specifically primary and preventative care. We were recently working in the emergency room, and a 65-year-old woman with a history of a TIA, hypertension, hyperlipidemia presented with chest pain, which, as Bulbasaur expressed, those are all risk factors for large cardiac events, large, costly, and debilitating cardiac events, such as myocardial infarction, also known as heart attack or stroke. And this patient expressed they were non-compliant with all of their medication and that they were non-compliant with primary care. And this really frustrated Bulbasaur because Bulbasaur wanted to know why someone with existing risk factors and an existing cardiac event would choose not to be compliant with medication and primary care. And this was a great opportunity to discuss the other determinants of health. So as mentioned, the behavioral choices we make and the health services we can access are two huge components, but also biology and genetics. You can't control if you are more likely just genetically coded to experience heart disease or cancer or something like that. Also, age, can't modify that factor either. Policies that are enacted by organizations and legislations itself also affect how we can access care and our health outcomes. Also, just the social and physical aspects of our environment. I let Bulbasaur know that we learned in my public health courses that zip code is one of the major determinants of health. For example, do you live in an environment that has more pollution, which is a good time to point out that that zoning would be also determined by local city legislative policy. Do you live in an area that is essentially a food desert? It's a lot easier to comply to a heart-healthy diet if you live next to a Whole Foods, for example, versus next to a Wendy's or a liquor store. So we took this opportunity to interview this patient in the ED. She expressed that she was not able to access her medication due to cost. She also had just recently lost her job and had lost her housing as a consequence. So it's a lot harder to stay compliant to a medication regimen if you are unable to even have secure housing, secure income, things like that. So I reminded Bulbasaur that from a public health perspective, it's really important to look at the why. We as Americans, especially, have this really bad tendency to pass judgment. I refer to it as the American individualism, where it's always pull yourself up by your bootstraps and we are responsible for our outcomes. Everyone has the same 24 hours in a day. But as we just discussed, some factors that's not true. A lot of the things out of our control, as mentioned, our zip code and things like this really are huge determinants of health. So after speaking to this patient and finding out the why, we were able to assist them. So we took their existing medication regimen, which they were not even able to adhere to, and found equivalent agents on the Walmart $4 prescription list. And this took, unfortunately, a very long conversation with their provider, which is also a barrier. But we were able to formulate a plan that fit this patient's financial budget. And they are going home, thankfully, not having any major cardiac events, and are able to go home now and be compliant to medications that will hopefully prevent those events in the future. Furthermore, this will ultimately save our health system money, because uninsured patients who experience these huge traumatic, debilitating events, such as a stroke or heart attack, that requires so many more resources and so much higher level of care and cost. So we were very lucky to be able to consider all the determinants of health, not pass judgment, find out why, and create a solution so this patient could access care and hopefully have better outcomes. So we're going to keep our mind open a little wider before we judge anybody for the choices, because the social determinants of health are very wide and varied and have such huge consequences.